Welcome, everyone, to day 4 of the Virtual Insurance and Reimbursement Conference. This is our final day. I know it makes you sad, but I'm really happy that you guys all were able to make it and able to handle the virtual platform because it's here for a while. So on behalf of NHF, we'd like to welcome you to day 4, and we're going to begin with the state session. And my name is Marla Feinstein. I'm the Senior Healthcare Policy Analyst with NHF. But before we dive into the session, I wanted to share with you a cool thing. We've had 192 HTC social workers, nurses, staff, and chapter leaders from 41 states participate in this year's conference. And to be honest, I'm really proud of that. I think it speaks to the work that we're all doing and we all spend a lot of time doing. Super proud of everyone here and every presentation. So I just figured I'd share all that with you guys because I know it, means a lot to you and all and the community we serve. I'd like to thank our sponsors again. So CSL Behring, Genentech, Grifols, Hemophilia Alliance, Novo Nordisk, Pfizer, Sanofi Genzyme, and Takeda. And at this time, I would like to introduce my esteemed colleagues, Bill Roby, Dalen Harp, Nathan Schaefer. And we have some special guests, so stay tuned. And with that, I leave it to you guys. Thank you.
Thanks, Marla. Good afternoon, everybody. Thank you so much for joining today. I was excited to participate in the past few days of the conference and agree that we've got a significant amount of representation from across the community. So thank you all for taking time out of your schedules and out of your days to join us throughout this conference. So I'm Nathan Schaefer. I'm the Vice President of Public Policy, and I'm going to get things kicked off here. We are a team of 3 that work on state policy and advocacy. We've divided up the country into essentially a third of which states we work with directly. So if you're unfamiliar with the state policy and advocacy team, these are the assignments for the respective states. And if you don't yet have a relationship with either of the 3 of us, please let us know, because we're here to partner with all of the chapters and HTCs in all 50 states to identify and accomplish state policy and advocacy goals.
Here's some examples. This was a weird year, obviously. Not a lot got done because a lot of legislatures adjourned early or had very, sessions that were chopped up into different segments. So, but nonetheless, we did have a number of states that actually got in-person advocacy days in this year. The list is right there. I know I was able to attend Ziggy's. He got his in. I know Hawaii and Oregon were on the same day on February 10th. So we're really happy for those states. They're able to get it done. I also know it's not listed here. Several other states did virtual advocacy days. Virginia canceled their advocacy day altogether because of safety issues surrounding the virus. Virginia usually goes first every year in January. We were successful in getting step therapy bills enacted. Right there, just lists Louisiana, but I also know that North Carolina and South Dakota also adopted restrictions on step therapy this year, which is good news. Accumulator adjuster bills were enacted in Georgia and in Puerto Rico. We now have a new chapter in Puerto Rico, so welcome Puerto Rico if anybody's on from Puerto Rico. Also, New York, Ohio, and California adopted plasma collection legislation that was not one of our top priorities, but the chapters worked on it along with the Plasma Protein Therapeutics Association. So we're happy to see that. I'm familiar with the legislation in California that they've been working toward for several years. So congratulations to those states in getting that through. And also the state of West Virginia adopted legislation creating a rare disease council. So congratulations, Fernando. So this is a copy. Some of you may have seen this before. If you haven't, we have presented a poster. NHF has not only at the Bleeding Disorders Conference in 2018, 2019, but also at NORD's Rare Disease Summit in Washington, D.C. We did one in 2018 and 2019 talking about our state-based advocacy coalition program and the states that it covers and some of the methodology for the program, the participants of the program, and the successes of the program from inception which I believe is 2014. So it's probably hard for you to read here, but the dark blue states are states that either are currently part of the SBAC program or have been a part of the SBAC program. So it is much of the country. And I think we should probably include, I don't think Vermont and New Hampshire are blue, but NEHA is on there, and they cover Vermont and New Hampshire as well, so we can color those dark blue.
This is the all of the states that were able to host an in-person state advocacy day in 2019. The vast majority of those are part of the SBAC program, but as you all know, we have 53 chapters across the country, so we don't have a chapter in every single state across the U.S. But I think in 2019 we did a total of 30 in-person state advocacy days. Obviously, this year we were not able to do anywhere near that number, but I think covering 30 states for state advocacy days is pretty darn impressive, given that we don't have a chapter in every single state, nor would it make sense to necessarily convene everyone if it's going to be very prohibitive from a cost perspective to convene everybody in Juneau, Alaska, for example. So I think we're pretty proud of that. And as you can see depicted in the images in the lower right-hand corner, one of those, the farthest to the right, is from California. You're going to hear from Lynn a little bit later about some of the advocacy successes in the state of California. The middle photo is from Alabama that hosted their very first state advocacy day in 2019. And then the image to the furthest left is from Hawaii, and you can see Bill is donning the interpretation of the red tie for constituents in Hawaii. You want to explain the kukui nuts?
Yes, and you can see the young man in the middle of that photograph is Daxton. I want to mention that Daxton had never engaged in advocacy before. He attended Ziggy's Future Leaders Conference, which was the weekend, the full weekend before that day. And he had, one of my favorite stories I tell about advocacy, which I won't go into now, deals with Daxton, but he had an amazing day and is the perfect story for a volunteer advocate who'd never been involved before. And he was involved again this year in 2020. So the kukui nut is the Hawaii chapter's version of the red tie for the Red Tie Challenge. I guess now that I've opened up this can of worms, it's unrelated, but it's also apparently a fertility symbol, according to Jordana. Anyway, this is Hawaii's version of the red tie, and it's a lot more comfortable than a red tie, I'd like to point out. For the SBAC programming and goals, this is our state-based advocacy program. So currently this year, program is covering 22 different states. There are some participants who cover more than one state. We have a capacity building phase of the program, which is sort of an entry-level grant designed to help a chapter start and maintain a grassroots advocacy program. And currently it's Hawaii, Illinois, and Nevada. And the capacity building part of the program is a 2-year process. So Hawaii and Nevada will actually graduate this year. And then they will be competing for grant money with the advanced advocacy program, which is a larger pool of money that is reserved for anybody who applies, but often a lot of the applicants, the people that are in the program now, have been through the capacity building program. And the advanced advocacy, as it sounds, is for chapters that have a more advanced or larger program that want to push the envelope a little bit with their program and become more effective year-round grassroots advocacy. And year-round is really the key there. We're trying to get chapters to engage, not just in a state advocacy day, but year-round. And those are the participants listed there for this year. This year, we also had some money available later in the year for what we called mini grants that we able to give Florida, North Carolina, North Dakota, Oklahoma, Pennsylvania, and Texas some grant money. And for this year, North Carolina and North Dakota is their first year participating in the SBAC program, and we certainly hope they continue to do so next year.
The thing I wanted to also note about the SBAC program, for anyone who's on the event today, keep in mind that the SBAC program in its first few years was by invitation only. Now, all chapters, all 53 NHF chapters are eligible to apply for either a capacity building grant, unless they've already gone through that phase of the program, or an advanced advocacy grant. So you're going to hear more about the program, its structure, and you're going to hear from a couple of leaders of recipients of SBAC grants in the next hour. So keep in mind, if you're wanting to amplify or really reinvigorate your state and local advocacy programming, every chapter is eligible to apply for an SBAC grant. The applications for that will likely be out. We need them back by the end of December, and we will get them out to all chapters as soon as we possibly can. So just keep in mind, you are eligible to apply for additional resources through the SBAC program.
Okay, so state overview. So this is really focusing forward for the 2021 legislative session. All 50 states will be in session this year. Every other year, there are 4 states in the country that are only in session every other year. It's always odd numbered years since it follows an election. So 50 states in session this year. We are assuming right now, as probably all of you are, that state legislatures are going to at least start virtually. Whether or not they stay that way the whole session remains to be seen. But we've got a number of priorities we want to mention to you and talk about what we're tracking at the national level with the coalitions we participate in. And you may be approached, if you already haven't been, about participating in coalitions on these issues. The same coalition, which NHF is a member of, the national level, focuses on step therapy legislation and legislation limiting patients' out-of-pocket expenses. Both groups have model legislation, which I'm happy to share with you, that is used as the basis for coalition legislation in the states where a coalition is active. And let me just point out, the same coalition is an umbrella group nationally, but at the state level, there are separate coalitions that work, often with organizations that are nationally represented the same, but it's really run by state groups, not at the national level. The target states for next year: Arizona, Arkansas, California, Maryland, Massachusetts, Nebraska, New Jersey, Oregon, Pennsylvania, Rhode Island, and Tennessee. A number of those states, I think most of those states, had legislation that was active this year but didn't make it through the process. Arizona was very close, didn't get it done before the legislature adjourned. There's also several states of interest. States of interest are one that the coalition tracks, but there's no identified leadership for a local coalition. So we just really follow those states, but the target states are where we hope to get legislation accomplished this year. The out-of-pocket expense part of the same coalition has changed a lot. It used to be known as Cap the Copay, if you're familiar with that. That has sort of, limited, in many respects, the Cap the Copay effort ran its course, and now it's the same model legislation is a little bit different than Cap the Copay. But they right now have just 2 target states for next year, Illinois and Ohio, and also states of interest include California and Tennessee. However, it doesn't mean coalitions won't be active on out-of-pocket expenses. As you all know, accumulator adjustment programs have become a huge problem for us and are a priority. 5 states and 1 territory have adopted legislation limiting in some form or another or outright prohibiting copay accumulator programs. This national coalition is called All Copays Count. Colette Koulianos on our team represents NHF. NHF and Arthritis Foundation are really, as well as the AIDS Institute, are really leaders in this area. The All Copays Count coalition also has a list of target states dealing with strictly accumulator adjusters. And I won't list them all there. There's about 20 or 22, I believe. They're down there in the small print. A lot of those states may also be targets that you may see people from the same coalition working those as well, because the Arthritis Foundation, their staff person works not only on All Copays Count, but also on same coalition. So I know a number of states have already been approached about introducing legislation. So if you are contacted by somebody from a group that wants you to participate, this may be what it's about. You're welcome to contact Dylan or Nathan and I to sort of verify if this is a legit effort or not, but I just want to make sure you're aware of this is the target state list for accumulator adjuster legislation. Utilization management is an umbrella term for the various practices insurance companies employ to manage costs as well as manage patient access to care, not only medical, but pharmaceutical as well. There can be various types of legislation that fall under this umbrella. Step therapy is actually a form, it's sort of a subcategory of utilization management. but some of you may have been involved in legislation dealing with standardizing the prior authorization process. Things like that are utilization management. There's nothing listed here. There is always legislation that is introduced during legislative sessions. It's often sponsored by and really advanced by medical professions. A lot of the doctors groups, because they're the ones that bear the burden going through the utilization management process. So you might also be approached on a utilization management issue by a coalition who's looking for patient support. Again, they're trying to form a broad coalition, and getting patients on board is always helpful when you're a provider. So that's another issue we'll be tracking, and we'll be happy to help you out if you're approached on any of those issues that you're wondering about whether you should get involved. Medicaid is an issue, as you know, we've been following very closely for the last few years. We've hired a consultant to help us out, help us manage the activity of the 50 states, as well as the federal government on Medicaid. So this is something going on right now that I think is a trend worth following, and that is states taking more control of their pharmacy benefit from managed care. The state of Michigan adopted a single formulary for all managed care companies. I believe it went into effect on October 1st. Fortunately for us, and largely because of the work of Hemophilia Foundation of Michigan, hemophilia clotting factor will not be affected by that right now, as far as we know. It is carved out of this process. Nevada and California, the states are taking back their pharmacy benefit under Medicaid from the managed care companies and managing it fee for service. Nevada starts both states start January 1st. And to our knowledge, we have been assured by the Medicaid staff, agency staff in Nevada, they don't plan on any changes for how clotting factor or other bleeding disorder products will be covered. And the same with CalRx, which is the California version of this, their new Medi-Cal pharmacy services. Right now, there's no change for hemophilia therapy, so I want to emphasize that right now. Obviously, in California, the HCC will be keeping an eye on that, and their lobbyist, Terry Cowger-Hill, has been actively involved in those meetings. DCHS, which is the state agency that manages Medicaid, has been having regular meetings that our community participates in, so we feel well represented there and well protected, but we will keep an eye on it. So again, we want to keep track of these issues. My understanding is, from someone who knows these issues better than I do, that states want increasing control over their pharmacy benefit so they can take advantage of supplemental rebates that they could negotiate with manufacturers. So this is something we'll be watching going forward. So this year, again, on the Medicaid side, Oklahoma and Missouri approved by ballot measure the expansion of Medicaid. North Carolina has been trying to go through this on the legislative side. Nebraska in there is the light blue. It should probably be dark blue now, because Nebraska's Medicaid expansion is finally going to go forward, even though voters approved it about 2 years ago. So we also are keeping track of, and I know our chapters are supporting efforts to expand Medicaid in their states.
Thanks, Bill, and thank you, Nathan, both. So now I want to talk a little bit about what NHF is doing, kind of from a virtual advocacy perspective. We know with COVID that we are unfortunately not able to do things in an in-person setting, so we have shifted to virtual. I'm sure that more than likely will carry into the vast majority of 2021. And I'm going to be getting into more of these topics that are listed on this slide about some of our virtual Hill days. Our Washington days will be virtual. A new digital advocacy platform that NHF has invested in that will also be rolled out to a vast majority of the states, including just about all the SBAC states that Bill and Nathan mentioned earlier. And then also too, always encouraging our folks to participate in any type of town halls. This is always something that is done during a non-COVID year, I guess a quote unquote regular year. But now with the epidemic, there will be much more opportunities for elected officials to engage with their constituents from a virtual basis. So definitely something that if something that you're interested in, please feel free to reach out to us, and we'd be happy to connect you with some of those resources, help you track when those events are taking place. But before I kind of get into what NHF is doing on the virtual perspective, I wanted to introduce, first off, Charlene Cowell, who is from North Carolina. She's had a lot of really great success this year on some virtual advocacy events. And so I would like her just to speak a little bit about her experience. Thank you, Charlene.
Of course, thank you. And I appreciate the opportunity to talk about this. So I am with Hemophilia of North Carolina, and each year we do a legislative day down in Raleigh, North Carolina. And of course, it was planned for June, and we realized, I think in March, that we were not going to be able to host our legislative days as we normally would, which of course we were disappointed. We realized that we just enjoy getting together, bringing families and individuals down, wearing our red ties, and going into the offices. But we also saw it as an opportunity. This was, a time where we could engage more people from around the state, people who otherwise wouldn't be able to make the couple-hour trip to Raleigh or take the time off of work. And also our treatment centers, who again have those limitations with us going down on a weekday. So again, we quickly flipped our perspective and took this as an opportunity. So the first thing that we did, we have an advocacy committee. And so we talked with the committee, we got volunteers that helped us develop a plan of what we wanted to do. We had 3 advocacy webinars leading up to the event to just really promote advocacy and legislative days and the topic that we were doing, which was Medicaid expansion. It's been our main advocacy initiative for the past 4 years now, and really just encouraging people to participate. So we had a volunteer that emailed all of the legislative offices to schedule the meetings for attendees, which was a huge help because we're a really small staff. And then we offered for participants who are newer that might be more comfortable having a more experienced advocate on the phone call with their legislative person or staffer. And then we also had a volunteer who drafted follow-up emails that could be sent, social media posts, and then, any other type of things. One of the things that we didn't get to do that we're hoping to do in 2021, as it's looking like that's where we're heading as a virtual legislative day, is we want to do a short video of our community members talking about the importance of Medicaid expansion. And then we also want to have a flyer that we can mail that has pictures on one side of our community, and then on the other side, just some talking points as to the issue. Some of the lessons that we learned is we'd like to promote it further out. Of course, by the time we realized we had to flip to virtual, we just simply did not have enough time to promote the event like we will in 2021. I think it's also important for us next year to carve out time to call and encourage attendees from across the state to attend, especially in key parts of the state where we really need that support. Maybe it's somebody who's on the fence about Medicaid expansion or somebody who's very influential in the Senate or the House. Send pictures in advance of whoever that the person's meeting with, of their kids, their medicine, just something visual, because we typically do that when we're doing it in person, is we ask people to bring things. And then since then, I'm really excited to say that we have created even more new connections with both senators and representatives in North Carolina because of our legislative day. We have also continued in conversations with our treatment centers about advocacy initiatives. I think, again, it was really good to have more of them participating this year, and we hope to see that trend happen in 2021. And then it's also not been official to the community yet, but we have a huge Medicaid transformation going on in North Carolina starting in 2021. And so since our legislative days, we've been able to talk with the Medicaid department, and they're going to do a presentation with a Q&A for the community to better understand what Medicaid transformation means for North Carolina families, how it's going to impact them, and just get some more information. And we're definitely going to do it in English, and they're hoping to find a Spanish speaker as well. And I want to thank NHF for providing the grant that's helping us to be able to do this, because it's been really beneficial to us. And just one last thing is make sure that the treatment centers and the chapters are communicating with each other on anything advocacy related. I will say in North Carolina, that has been critical for us to get the stories from the treatment centers of patients that are being impacted so that we can bring it on the state level and the national level, including like the SNF bill and stuff like that. So just appreciate all the support of the treatment centers.
Darlene, thank you. This is really, really helpful to provide some context about how chapters can not only engage in virtual advocacy, but really ramp up their advocacy efforts. And I just have a follow-up question for you. And North Carolina is one of the states that I've had the privilege of working with for a few years now. And I'm wondering if you can just give a couple of thoughts about how do you identify and attract and retain quality advocacy committee members, because this is one of the expectations of all of our 53 chapters, that you've got a advocacy committee that you convene at least monthly, just a conference call, although it's been Zoom of late, and I think that's probably going to continue. But how have you gone about structuring and sort of revisiting your advocacy committee composition?
So I think one of the things that's been really successful for us for the last couple of years is that we've made a concerted effort to infuse advocacy into almost every event that we do. At least one session, we talk about the importance. We've been getting elected officials to come to events, have the Medicaid department come to events. And I think bringing the information to our members in a way that they can understand it and in a way that they can see why it's impactful for them has been really good for us to connect with them and get them in. I think to just being honest with them that we don't even understand all the lingo and all the complexities and things like that, because advocacy can be really intimidating to people. And so having those open conversations and just being very clear that people don't need to be experts, they just need to tell their story. And I think that that's helped us to get people on the advocacy calls. And then when they're on the call, they hear it, we take notes, they can go back and review those notes. They can ask questions about what does this acronym mean? So I think that that's been really good. But for sure, having this conversation at almost every event that we do is helping.
Excellent. Thank you. One of the things that I will just flag for everybody that I know we've talked about in North Carolina and a number of other states with whom I partner on their state and advocacy goals is about getting people from every corner of your state. Because one of the measures of effectiveness of your state advocacy program is your ability to influence legislators from every corner of your state. And many legislators often, I mean, I've heard from legislative offices that have said, what's your address, before they'll even fill a meeting. Like, sometimes you actually need constituents to carry your message to be able to reach elected officials. So I just wanted to add to the conversation. One of the things I encourage you all to think about is, what kind of geographic diversity do you have with your advocacy committee or with your advocacy leads? Because in order to be as comprehensive in your effectiveness as possible, you are going to need people from every area within your state. So think about how you can reach out. Some of those districts are a lot more expensive. They're less populated, but a larger area. But it is really important that you've got advocates that can speak to the issues from every different angle and every different corner of your state and jurisdiction. So just be thinking about that. I'm going to shut up now and turn it back over to Dylan. Thank you, Charlene.
Thanks, Nathan, and thank you so much, Charlene. So now we would like to invite Lynn Kentz from California to talk a little bit about some of her virtual advocacy success this year. Thanks, Lynn.
Thank you so much for the invitation to share. And first, I just want to say, I know I see a lot of my colleagues on the phone, and I appreciate the opportunity to share ideas, because I learn so much from all of them and the things that I see them doing across the country as well in their advocacy efforts and their education efforts. Charlene talked a lot about their virtual advocacy day. We also in California had to pivot. We ended up sort of pushing our legislative day further into the year. Normally it would be in April or early May. We ended up pushing into June and then holding our virtual advocacy day. And we did it structurally very similar to how we would host a a legislative day if we were in person. We put people in teams similar to how we would if they were in person. So they did have a team that they met with, and then we scheduled those meetings via Zoom. At least in California, for the most part, staffers as well as legislators were willing to get on Zoom calls, and in most cases were willing to even use video and participate that way, which was great. So one thing that I would just encourage everyone that we learned from that experience is that it's really important that if you are going to have a group of people meeting, that you give them an opportunity to sort of practice and plan out how they're going to do their presentation before they get into those meetings. Because in a in-person legislative day, you sort of naturally have opportunities to do that. You're in the hallway before the meeting, and you kind of might in an impromptu way say, okay, you're going to go first and you're going to go second, and you can more easily read one another's cues in person. Whereas on the phone, on a Zoom call, things will lag or one person will dominate if you don't kind of plan out who's going to take what part and what order they're going to go into. So that was something that we learned that was really key. I think another thing, we did have a virtual toolkit that we created that we had available on online and leave behinds. And we didn't distribute those in advance to the legislative offices, kind of for the same reason that you typically would tell people at a ledge day, hey, don't hand them the sheet before you start talking because you want them to listen to you. So we didn't distribute them ahead of time. But I do think that this year we'll probably have the team captains have that document and give them some instructions ahead of time, so that maybe if you are in a Zoom situation, they can maybe screen share that and the person can kind of follow along as they're talking. Or that might even be a way to share, like Charlene was talking about, the idea of sharing like photos or some of those things that you typically do. You could plan that ahead of time and have someone on the team share those pictures like in a screen share type setting in the meeting. So just a couple of things that we learned. The other thing that we're going to do this year is, leading up to our Ledge Day, as part of our normal webinar series, we're going to have topics that relate to advocacy to kind of prepare our community for Ledge Day. So there'll be standalone topics, but things that will contribute to them feeling more prepared for the legislative day. So like we're going to have a mini workshop on telling your story as one of our webinars in advance of Ledge Day. We're going to have kind of like a what is Advocacy 101 type of webinar prior to legislative day. So a number of the topics in the couple of months leading up to Ledge Day will prepare them. The other thing that we do in California is we have 4 quarterly healthcare access forums with our stakeholder partners, providers, and industry folks. And then we also have 2 policy summits a year, which are essentially our stakeholder meetings, where we bring everyone in. And even in the virtual format, those have worked pretty well this year as an opportunity to really discuss, like, what are we seeing as the access issues? In California this year, we had some big issues with GHPP, which is one of our state-funded safety net programs, where just due to changes in the way that the state was functioning their work processes with employees at home, we were getting tons of delayed applications where people were not getting their renewals in time. And so having that regular communication with folks was really critical to know, like, sort of the breadth of what the problem was, and then be able to take that to the state and really address those issues and start to find solutions to them. Those just open dialogue with folks was great. And we all miss being in person, but we actually found the virtual settings pretty effective to be able to continue to hold those meetings. We used breakout rooms to be able to get into smaller groups to discuss different policy topics. And that was really helpful to kind of help us set our agenda going into next year and kind of know, what do we see as the big issues that need to be addressed. The other thing, Nathan, you just touched on this in terms of the geographic representation. California is a huge state, obviously. It's really difficult to get people from every corner of the state at an in-person event. And so while, again, we can't wait till we could be back in person on some things, we see this as an opportunity to really capitalize on the virtual platforms and hopefully get people more engaged and, probably find ways to continue to use these virtual platforms going forward in order to get more representation from people in different places that might find it difficult to get all the way to Sacramento in person to do some of that advocacy. So we want to find creative ways to merge the virtual with the in-person once that is available again.
Awesome. Thanks so much, Lynn. And again, thanks to Lynn and Charlene. These are two amazing examples. I know other chapters are doing some amazing work as well. With that said, if you are a chapter ED or you are trying to get connected with your chapter and you would like to get involved in some of these activities towards the end of this year or into 2021, please feel free to reach out to me, Bill, or Nathan, or someone at your local chapter. I'm sure that we would all be more than happy to get involved and help you out. Now, you just heard from two of our amazing chapter EDs on some of the virtual advocacy work that they did in 2020. So now I kind of want to move to something I alluded to a little while ago. So this is a digital advocacy platform that NHF has invested in. It's called Phone to Action. It's a really, really amazing tool that allows for NHF, our staff, to, when a piece of legislation, a rule, a regulation gets brought up, we are able to write out the kind of all the details, the nuts and bolts of it, and then we're able to send it out to our community members and advocates. This is a really neat tool because the end user does not really have to know a lot of the policy details about it. You leave that part up to us. So you can kind of see on this screen, we've already pre-written what's on my left side of it. You just have to enter in some basic biographical information. Then you have the opportunity, literally with the click of a button, to send emails to your two senators, to your House representative member. You're able to tweet and Facebook at them. And you also have the option to make a phone call as well. So it's a really, really neat opportunity. I believe I saw in the chat, we launched this action alert around skilled nursing facilities on Monday afternoon during Joanna Gray's federal update. And I believe I saw in the chat that Sue said that it took her 30 seconds to send an email to her federally elected officials. So again, this is a program that we're super excited about. We're going to continue to utilize in 2020, especially use that in 2021 as we shift pretty much a predominantly virtual setting. We will also be rolling this out to our state chapters as well. I believe we're rolling out to about 23 or 24 of the state chapters. This rollout will take place throughout the month of November. So we are really excited to learn and grow with this program, and then also learn and grow with this program with some of our amazing chapter executives from state chapters across the country as well.
I just want to interject here. It's Marla. And I think this gives the HTCs an awesome opportunity to interact and engage with local policymakers, because you can easily, I dropped it in the chat, just send out your request, your support. I just wanted to add that, like, as a way for you to become more engaged when they often will listen to providers more than they sometimes will listen to us.
Absolutely. Thank you, Marla. And I'll mention as well, there is a feature as well. Let's say if you're in a super big hurry and you just want to send out the message that we've already pre-written, that's fine. We'll always encourage folks, and you have the option to add in your own personal story as well. So if you do have time and you do have a unique perspective or example to give and you're willing to share it, that would be great as well. So now I kind of want to shift to voting a little bit. Obviously, there's a big election coming up next week, and obviously it's against President Trump and then former Vice President Joe Biden. But it's not just a big election year for the rough third Senate election. All 435 members of the House of Representatives are up for re-election. And then also there are a lot of major governors, state legislatures, mayoral races, and even smaller local government races as well. So again, at NHF, we would always encourage everyone on this webinar and all community members and all your friends and colleagues to get out and vote. I'll give a plug at the tail end of this presentation for a voter education platform that NHF has also invested in that can give you a ton of kind of cool tips, tricks on everything you need to know voting wise. So again, I won't go through everything. You can see this on the screen, but I did want to focus on there are currently 10 Senate races that are currently rated as either they will flip, so they will change from either Republican or Democrat to Republican, or it's rated as a toss-up. Looking at the list and doing some research on this, it's interesting that Georgia actually is going to have 2 open Senate seats. So that's interesting. And I would also want to mention these 10 tight Senate races. You hear a lot about, well, who will control the Senate? I think it's pretty well settled that the House will stay in the party's control that it's in right now. But on the Senate side, there's a possibility that control of it could flip from the Republican side to the Democratic side. In order for that to happen, the Democrats need a net gain of 4 seats to take control, or they can take control by gaining a net gain of 3 seats. Plus, if Joe Biden wins, then his vice president would be then Kamala Harris, who would be able to break a tie in the Senate. Now, when we're talking about what's the big deal if one party's in control in the Senate, this would allow the party in control to set committee assignments. They're in charge of floor policy. They'd be in charge of what pieces of legislation goes through or does not go through on the Senate floor. So again, just something that we want to flag for everyone that this is a possibility. And again, just a plug to get out. Please vote, please educate yourself and get involved. Just real briefly, as you might have heard and guessed, our 2021 NHF Washington Days will be virtual. Our priorities, assuming that our SNF bill is not included into a larger package, we will be working on reintroducing that. That will be one of our major topics going into 2021 and when we're virtually in DC. We'll also be looking at federal legislation around copay accumulator adjustment programs. And as always, we will be advocating for appropriation language that supports various programs that directly impact our community members. And then also, I think it's important to mention too, not just on the federal level, not just on the state level, but on the local level as well, there's going to be a lot of turnover, a lot of new faces, a lot of people who have been in politics before, a lot of people who have never been in politics before, who are going to hold very important positions that is going to directly impact your way of life. And it's probably a pretty good assumption that a lot of them are not going to be healthcare policy experts, and they're not going to be bleeding disorder experts as well. So this is when the impetus is on NHF, on our state chapters, on our community members throughout the country to really educate people on who we are, what are the issues that we encounter. It may be something as, going back from the basics to what is a bleeding disorder. Don't ever kind of assume that if you're meeting someone brand new that they're going to know about hemophilia, or they're going to know that you have von Willebrand's disease or something like that. So just something really good to keep in mind as you're kind of strategizing and going into your advocacy efforts into 2021. Finally, just wanted to mention as well, there are 11 governor's races this year. So again, bringing this idea that there's going to be a lot of turnover on the state level. So important. There are doing some research on this. There are a lot of mayoral races that I could not fit into one screen. These are just some of the mayoral races that are in major cities across the country. So again, not to keep harping on this, but there's going to be a lot of turnover. There's going to be a lot of new faces. There's going to be a lot of engagement and advocacy opportunities for us as a community. And then finally, here is the plug that I was going to put in, the link on the screen. And if not, I can drop it into the chat. This is a voter education platform that could tell you it's probably a little bit too late now to register to vote in the November elections if you have not already, but you can still visit this website. It can give you polling information, anything to do about mail-in ballots. It lets you know what you have to bring in order to vote. And you can find just a lot of kind of cool questions and tips that you might need to vote in your respective state. I'll say, for example, so I'm based in Dallas, Texas. This is something that I had never heard of before, but actually in Houston, in the southern part of the state, starting today, they are actually opening up 24-hour polling locations where you can vote 24 hours a day. So again, that's just one example of something that's unique in Texas. So please visit this website, check and see what's going on in your state. And again, if you have any more questions, please feel free to reach out to me or to Bill or Nathan. I know that we'd be happy to engage with you on this. And then I will stop talking and I will open it up to Bill or Nathan if they have any more comments or if there's any questions.
Thank you, Dylan. I have two things that I want to emphasize. First, what Dylan alluded to is that when people are newly elected to office, they don't know what the hell they're doing. They likely don't know anybody with a bleeding disorder, and that presents an opportunity for us as a community and as volunteer advocates to educate them about the realities of what our families go through. And it's an opportunity for you to be able to establish yourself as a resource to an elected official's office. And that could be Congress or at the state or local level. So keep in mind, and as you think about many states where there are term limits, where it's sort of mandated that people can't be in office for decades and decades, they really don't know much about bleeding disorders. So use that as an opportunity to not only educate them, but to become a resource to the office so that if they do have a question about bleeding disorders, you're the person or you're the family that they're going to call. Second is just about voting. As nonprofit organizations, we of course cannot tell people who to vote for, but we can remind people of the rights and the responsibilities of voting. So please don't be shy about encouraging community members to exercise their right and their responsibility to vote. We can't say who to vote for, but we can remind people this is when you need to request an absentee ballot by. This is when your poll location is closing. Anything of that that helps people facilitate their ability to vote is well within the purview of what nonprofit organizations can do. So I'd like to speak on behalf of the whole team in saying we encourage you to encourage as many people as possible to exercise their right to vote before Tuesday. Bill, do you have any thoughts before I think we kick this back over to Marla?
No, nothing.
Seriously, no thoughts, Bill? Absolutely not. And with that, I would like to thank our presenters, Bill, Nathan, Dylan, Lynn, and Charlene. And we appreciate all the work you guys do all the time. And also, I do really want to mention that to all the center staff that this is like an entryway. This is a way for you to become more involved. And I know I've been to many chapter events when I was in North Dakota, which was awesome, by the way, and they had providers there. It's just a way for them to really engage and they enjoy being around the community. It's just really, it's a beautiful thing when you have events where everyone is included. And with that, I'd like to thank our speakers, and we'll bounce out of here and get you on to Matt. Thanks.
Thank you.